New tonight, researchers are finding a link between valley groundwater and kidney cancer. As Channel 5's Christian Von Preising reports, it's an issue in areas where people are getting their water from wells.
There's new information about the impact of contaminants in our soil and our health. It's an issue in rural places across the state where more people are likely to get water from a well.
El agua de aquí no hay agua potable.
The water here isn't drinkable, says Pedro Martinez. He lives in northern Star County. Everyone we spoke to at this community center in San Isidro says they have a well, but they don't drink the water.
Casi todas las personas aquí compran el agua para tomar en la tienda.
Almost everyone buys water at the store, he says. Many we spoke to say they've heard about an issue with arsenic. Arsenic is naturally occurring in the soil and more concentrated in certain regions.
We link this to cancer data from the National Cancer Registry.
Dr. Taehyun Roh is part of a team at Texas A&M that compared arsenic concentrations in wells to the rates of kidney cancer across the state. The research drew on more than 3,000 private well readings across the state, including the valley, which were drawn by the state. It found a relationship between arsenic and kidney cancer.
Our study suggests that even low-level arsenic exposure below the current EPA guidance level of 10 parts per billion in drinking water may be associated with an increased risk of kidney cancer.
He says previous studies have linked arsenic to cancers of the bladder, lungs, and skin. Well contaminants have drawn the attention of state employees. In May, they visited San Isidro and other communities to offer well testing services. Residents have been learning more about what's in their water. In valley counties, the researchers' data shows arsenic is showing up at 1 to 5 parts per billion. Roe says 1 to 5 parts per billion increases the risk of kidney cancer by 6%, and rates of more than 5 parts per billion raise the risk by 22%.
This implies that the current arsenic regulations for drinking water are not sufficient to protect public health. So it is crucial to strengthen regulations, improve water infrastructure, and implement targeted public health interventions to reduce arsenic exposure.
Roe says the valley is supplied by the Gulf Coast Aquifer, which tends to have higher rates of arsenic. The research on this issue at Texas A&M continues. Christian Von Preising, Channel 5 News.